Yes, it's live.
So just a minute, it's going live on YouTube. So it's connecting.
It is live already.
Yeah, it's live showing now. So hello, salam, namaste, and sat sri akal to all my viewers. And yet
Namaste
welcome.
and Sastigal to you as well.
Thank you so much, sir. And I welcome all my viewers to my new episode of What's Your Story with a very different forum today. All together with a very different forum today, where we are going to talk about mental wellness and consciousness.
Yes.
So, yeah.
First of all, it's my pleasure to be participating in this wonderful program where the large goal of helping a lot of people in understanding the positive health. And I'm
so much,
thankful for you. I'm thankful for you to introduce this topic to the world in general.
Yes, this is the need of an hour, sir, and I'm thankful to you. So you agreed to come to this show. So guys, let me introduce our special guest on the board today, which is Dr. G Prasad Rao. And he's a senior psychiatric consultant and at Asha Hospital. And he's the owner of Asha Hospital also. And also, he's a president of Asian Federation of Psychiatric Department. So here today, I want everybody, pain cannot be wiped off with tears. Life is only given once. So why not to enjoy this life instead of, let it just go like that? I feel that I want a small introduction about you, sir. It is beneficial for all of us, all our viewers, to know about you. As a childhood, why did you choose psychiatrist department as your main domain? What inspired you?
Thank you very much. I think this is a beautiful question to start with. My passion for psychiatry was always there during my undergraduate medical school, where my professor of psychiatry, Professor N.V. Ramana Rao, has motivated me to see through the understanding of the human psyche, if you may. Understand how does he think? How does the emotions come? What is the basis of these emotions? How does the emotions and thoughts make one's behavior so unique, like you and me? Each one of us who are watching this program will understand each one of them have a very unique sense. And this is all connected to a large extent the way they are brought up, the genetics, the brain functioning, and all. But it is always a fascination, if you may, to know, to predict the behavior. See, heart rate you can predict today with an ECG. You can do an echo, you know the heart. But to understand a man's psychological process, you need to interact with the person. So this is, I would call, a software science of the brain. So I'm a software specialist of the brain and psychiatry, and the passion for me is now almost around 40 years. I love this branch like anything.
That I can see. I have been knowing you personally too. That you know very well. And wherever I am, I really thank you, because at times I really had a kind of a depression feeling, what you call it as today, where I need to open up with somebody, and you were there for me always. So I request everybody to open up, whether it's a doctor, whether it's your friend, whether it's your community, whether it's a society. This is the need.
Exactly. You need to really, as you correctly put it, You need a friend to talk to. You need a relative to talk to. And all these people are partly psychologists to some extent. They listen to you, they comfort you, say good words, give a pleasant feelings. And when you are in distress, also maybe give a shoulder to speak to, lap along, and go forward. You're right. We need people all through our lives. It might start with your parents to begin with. Our parents are the best psychologists to start with. Then you have your sister or brothers. Then you have
Correct.
your spouses. And then as the life goes on, you tend to pick up based on your psychology better people whom you consider good enough to help you.
Very nice, sir. I really feel. But do you think, sir, in today's society, the word, how do you term the word depression? What is the definition for you?
Now, depression, as you put it, is such a common emotion that every viewer who is watching this program now or in the future would have tasted it at least for a transient period. It is like a happiness, it is like an anxiety, which each one of us would go through. But this depression, for example, you failed in an exam, or your close friend is leaving you to go to another country for good, or
Mm,
some financial loss. It
mm,
leaves you a trail of a small period of worrying about that event and
mm.
makes you little sad. But
Right.
our brain has the strength and you can say resilience to come bounce back. That's why people keep saying, I was depressed, but no longer I am depressed. That means they can bounce back without anybody's help. So that is such a common emotion. And most of us would have gone through grief at some time or other. Grief is a sad feeling. But what we call clinical depressive disorder
Yes.
is, for the sake of a very simple clarity, depression occurs or the emotions occurs because of certain neurotransmitter connectivity within the brain in which the neurotransmitters get deficient relatively. And that leads to a set of symptoms, which is like sadness, unhappiness, not being able to enjoy good things in life. Say, for example, a person in a little sad mood, even if he hears a good news that he won a gold medal or she won a best prize in a contest, they might not enjoy as much when they are not depressed. In fact, they might say, okay, what if we read, everyone can get a gold medal. That's not so great. So sadness, unhappiness, not able to enjoy things, not getting sleep properly. Sometimes actually whole night you don't get sleep. You tend to weep easily. You tend to only remember negative thoughts. What is negative thoughts? I've not done any great things. I've done a
Right.
wrong thing. I'm feeling sad. I'm worthless. I'm hopeless. I'm
I'm fit
weak.
for nothing.
I'm fit for nothing. That means, in spite of, you can say, you've achieved two or
Everything.
three milestones, when you are in depression for that period, you feel very sad. So this is the syndrome. And mind you, the 2 3 facts which I want the viewers to remember. Unfortunately, depression is 3 times more common in women than men, world over.
Exactly. Exactly. I
Three
wanted
times.
to come to that point that in teenagers of or what you call the youth of today,
Yes.
it starts, I think, from there. Because when teenagers starts to, get aloof from parents and start towards friendship, moreover to this society, which is moving as fast as anything can, move faster. That's when the gap starts. So how to identify at that particular time as a parent, as a family member, as a relative, what do you advise? What can be the identification symptom at that point of time?
The most important thing is to each one of us have a certain degree of normality in the youth also. We are all
Right,
energetic, but
right,
friends, relatives, parents. Notice that Previously, this young kid used to be very bubbly, very happy, very energetic, was reading well, would sleep well, was not spending so much time on the mobile or in the computer games. Nowadays, he seems to lose interest in the studies. The first symptom is usually in a 2 to 3 month cycle, they start finding that the individual lost interest in what usually they used to love. So that is an early symptom. The other symptoms are usually in youth. There's a mood swings and aggressive mood swings. Suddenly get angry, suddenly weep, suddenly love, suddenly hate, with no reason, getting unnecessarily stimulated, spending the most people don't know that during depressions, people do waste money by, you can say, buying sprees. They might buy 6 or 7 dresses when they need only 1 or 2 dresses. So buying sprees, and of course, overeating food or not eating food. Overeating food is quite common. So these are the certain symptoms. But most important, remember, we are not comparing individual versus society. We are comparing individuals' background to the current period. And you are right. Youth is the most vulnerable because of three things. First is the biology changes. They are growing very fast. Body changes. Then there is also a perception changes in which each individual at that point of time, the body changes so fast, both in women and men, that there is a pressure to compare, compete with everyone. And this competitive world, what is leading is more and more competition than a satisfaction at some level. Third, this is called biopsychosocial. Biological, I told you. The female sex hormones and male sex hormones are spurted during this period, and brain also grows maximum during this period. So this is a time where the changes within the brain and changes within the body actually leads the individual to cope to the new needs, apart from the change in the sizes of the body, but more important, the change in the emotionality, change of comfort. This is an area of conflict of being independent versus dependent. Till 12 years, 13 years, you are all dependent on the parents. Now 14, 15, 16, you suddenly starts feeling that you are grown up, which is not true actually. Grown up actually occurs little late, around 20 to 23.
25.
25. But this is a phase where everyone, and unfortunately, the first episodes of depression is more common in the second decade. That is between 15 to 20. So, live recording, live recording. So, what I'm suggesting is don't take light. If the symptoms last more than 2 months, as you correctly asked me, how to diagnose? If there is a change in symptoms for more than 2 to 3 months, this is a time where we realize that there is probably a hormonal change. And hormonal change in the body is one thing, but hormonal change in the brain, deficiency, I would call it, which leads to this symptom. And mind you, depression is like diabetes. In fact, much easier than diabetes. In diabetes, at least you have to take lifelong treatment. Depression is only for short treatment. Diagnose, recover, and then go forward in the life. That is the slogan I would normally say. Depression is just like a passing cloud. It comes and goes. What you need to do is share with your family members. But if the symptoms are lasting more than 2, 3 months, maybe you need a psychologist or a psychiatrist to help you out by two means. One is psychologically, we do psychotherapy, and biologically, we might give you a short dose of antidepressants till an individual recovers. So this is simply a story which you find very regularly hearing from others.
But sir, giving antidepressants is the only way to cure?
Not necessarily. It is one way. In fact, I suggested first is psychotherapy, cognitive behavior therapy, changing the negative cognition. But it depends on mild to moderate depression, we do psychotherapy.
I'm trying to interfere you here. What if the person who is suffering with a loneliness called depression is unable and denies to go for a cognitive behavior therapy, what next can be done apart from the medicines?
You are right. See, in today's world or from time immemorial, depression is so, it was there.
It
It
was
is
there, but it
common.
was unidentified because people used to have unawareness about it. People used to think indigestion hoga, खाना ज़्यादा
Yeah.
खा लिया होगा, you are quiet, कोई बात नहीं, ठीक हो जाएगी, leave it. But they never used to go back to the root cause.
I think you have brought out hit the nail on the head to suggest that in the world, across the world, WHO, that is World Health Organization,
Correct.
when they have done a survey, what they found in the most recent is depression is the second most common cause of disability of losing work. See, don't just assess only losing work. See, housewife not able to work, a student not able to study, the any job you are not able, you are otherwise proficient, but nowadays you are not able to do. All these things, especially if it is more than 2 3 months, the days lost and the productivity lost is quite phenomenal. So, but your question also is important in the second contest that a lot of people don't recognize, deny a depression. We call it denial,
Or
and
stigma.
or they see it coming. They know it. It's the family members know it, that the individual is not like the usual self, but they want to
Yes.
delay to see. As you correctly said, this is due to gas. This is due to this. But
Yeah.
my suggestion as a professional is, the
Yes.
earlier you interfere, you might recover fast and the disease goes away early. If the longer time you take to go to a professional, for example, 6 months or 9 months, you might have to take medicinal support. So your question is also important to that extent that some people do need medicines compulsorily, but majority might even recover with cognitive behavior therapy or other forms of personalized psychotherapy. Sometimes in a couple, if
What
for
is that,
example,
sir? What is that?
again, there are
Personalized.
personalized psychotherapy is, depression is unique to each one of you.
Hmm.
Each one of us, when we get depressed, we react in a different fashion. So we go
Correct.
into the personalized conflict, each individual's conflict. In a youth, for example, relationship, goals, target, financial, and other things.
So
So
many
we go
things.
into these issues and try to tell them through formal psychotherapy, that is counseling, what is the proper method to keep the change the goals, how to think positively instead of thinking negatively. This is again a behavior we suggest, like do a pranayama, do yoga, have an activity. Now you said loneliness. That's one of the typical identifying symptom of depression. So come out of the
Correct.
room, meet people, meet and play with the games. All these things are important. And as we work each one, it's a very personalized psychotherapy which we go through. So,
So in other words, sorry, I'm just interfering. Please carry on.
I was just concluding saying it's a tailor-made treatment with each individual. I don't use the same counseling to each individual. We go into kind of a personalized one.
Right. So personalized treatment is like counseling, right? So you
Yeah.
counsel and you let it out. So why not our parents? Why people run after doctors, counselors? Why not at home?
No, I actually started off saying, and you are very right to say that our first counselors are our parents. Our second counselors are our friends. Our third counselors are our close relatives. So these three, they would do it. They would do all the time. For example, motivation building, positive motivation, saying you have done much better than this. This is only a small temporary phase of bad, you can say bad time. Now build up. So this is done. So beyond, we always need the family, and India is rich in family support system, as you know. India is a country where families are tied up, extended lot of members, including your third maternal uncle who can come and counsel you when you are in a low mood. So these things are needed. So we use that as a co-therapy. But as I said, once they come to a clinical syndrome, probably that's where we need a professional help along with the family support, friend support, teachers. These are very important tools. They
Teachers,
identify
right.
that this was a very bubbly boy. Last 1 month, I find him just sitting in a corner, not sometimes missing the classes. Why? So he will call, the teacher would call the boy or girl, sit with them, talk to them. They might come up with some unique problems that my grandmother is not well, or my father is like this, all those things. Listen and counsel. So counseling is done at multiple levels. We do at professional level. That's the difference.
Right, sir. You're absolutely right. So coming back to an incident which happened day before yesterday with Sushant Singh Rajput ji and many other celebs, not for celebs in a different segments, also with common people. Also, you know, do you think a chemical imbalance is somewhere related to suicidal tendency?
Why somewhere? I think you put a bit question mark, but I wouldn't even put any small question mark there. Depression is a medical disorder. So let us remove the, you can say stigma or
Mm-hmm.
shyness or denial.
Shyness or
Uh,
denial. We are in a mode of
denial.
denial. Yeah.
Denial. So what is it? It is a brain disorder. Now, brain disorder, every one of us can get. If it get it, there is a treatment. So it is. Now you also brought out a very important concept, important question rather, about celebrities' depression. See, among the population, there are some small sects, sectarian you can call them, who are more prone for stress. I'll tell you.
Mm,
For example, film actors,
mm.
they are public figures
Public
all the
figures.
time,
Mm,
and they have a high level of competition.
mm.
They also have a high level of failure. To become a hero or heroine, it takes quite a large amount of emotional, apart from personal skill. Now, this bond is so fragile that their competition is within the industry. It's also in the society. So
Mm.
they don't want to expose themselves. But
Yes.
I would like to bring in through your YouTube program,
Yes.
Deepika Padukone is
I know,
probably a
sir.
great ambassador who
I
still
know.
promotes through her media.
Yeah.
Defeat depression, uh,
Live, love, laugh.
live, laugh, and love. So all the three are
Yeah.
important for recovery. So this sect actually needs, and you have brought a very important point that suicide is a peak of depression or a maximum depression, you can say. That means the deficiency is weak. At that time, what we do is we actually support emotionally, use, try to bring, try to say that we are there. Remember, people who want to commit suicide also want to talk to somebody at that time to share
Mm.
their feelings with others. So a
Mm.
person who has gone through this sad state of suicidal thoughts and ideas and about to attempt, they need our support much more. Instead of commenting saying, you're unnecessarily worrying, don't worry, it'll go away. You better listen to what the individuals say. And in the end, after listening for 1 hour or so, tell them that you have so many strong points, you can live much better. There are a lot of family people depending on you. They love you. Everyone loves you. So bring the positivity, live, love, and laugh. So bring a smile on their face and then see that they don't attempt suicide. So our goal is suicide is prevention. Suicide is preventable. We need to prevent the suicide. Let us all join hands through this YouTube
Correct.
to bring these
I join hands.
individuals, bring the individuals back to normal life. Okay?
Yes, I do agree. So my next question to you is, sir, why if somebody is diagnosed as, you are going through a depression and people say, अरे ये तो पागल है, हम एक छोटी सी चोट लगती है या हमारे कोई बॉडी में कहीं कुछ डेफिशिएंसी होती है, वी गो टू अ जनरल फिजिशियन बिकॉज एवरी डॉक्टर हैज अ टर्मिनोलॉजी और अ डोमेन गिवन टू देम सो दैट वी आइडेंटिफाई ये फिजिशियन है, ये गैस्ट्रोलॉजी के लिए है. सो व्हाई अ साइकियाट्रिक or a psychiatrist word is considered so big hype, कि ये तो पागल है, ये वहां गया तो पागल है.
Thank you. I think through the YouTube, I think you have brought a very sensitive. It was better. It started improving. Today, probably it's still there, but I would also like to define the word pagal in a colloquial sense is the most common abused word
I'm
sometimes.
sorry I used Hindi word, but that's how people address. That's how people address.
No, I'm agreeing with you that people are, but I would only differentiate on one issue. Routine pagal is different from using pagal as a stigma,
Correct, correct.
which
एक
we don't
आदमी
know.
एक के लिए पागल या एक हॉबी के लिए पागल होना is a good thing. You are doing something constructive. But
Yes.
अगर you're suffering from such a disease or illness or a stress or anxiety for that matter, then you are considered as a different pagal.
So what will work? I think you and me together, along with the large public following us, will tell them that, see, this is
Very
depression,
true.
as you correctly put it, is a disorder of the brain. One important function of the brain is thoughts, emotions, feelings, and perception and memory. So these areas are affected, so we can treat it. So let us move with the slogan that depression is a disorder of brain and it is treatable, just like as you correctly said, even a
As a
common
fever.
cold needs
As a
as a
fever.
fever,
As a common cold.
common.
Yeah, as a diabetic.
Exactly.
As a thyroid.
Yes.
It is as
Anything.
simple as
Thyroid deficiency is treatable, but those who
yes.
suffer from hypothyroid till they are treated, they suffer very badly. Like that, depression is treatable and it is curable also.
One important question to you, sir. How do you feel that this corona, this has impacted the whole world very badly? Yet it has brought all the family members together. Look at the irony. Everybody of us are together in one home, but still there are increasing cases of suicides. Why?
There are two important issues which you brought out, and I agree with you on two important issues as well. One, Corona is something which occurred in 100 years and changed our lives for good. I'm thinking good mainly because for 2 months you are locked down at home. You are with the family.
We are with
Each
everybody.
family member tells you. Each parent understood the child much better. Each parent understood their teenager much better. Spouses understood each other better by living together positively. But there is also the flip side of getting locked down, the fear, deaths related to corona, and there are enough number of cases, new cases. In fact, some people started worrying that I have already, or I might get contaminated and I'll get a corona, and I might die of corona. And there are a few cases who actually attempted suicide thinking that they already have likely to get corona and there's no treatment for corona, which is not the case anyway. So one important point through message through this video is corona has severe mental health issues as well. OCD behaviors have increased. Obsessive compulsive behaviors means repeatedly washing long because of a fear. Repeated checking through various blood tests. Also, there are patients who are doubtful about that. Depression is common by these difficulties of socio-economic reasons, which can lead to. So there are multiple factors which have led COVID. But let us face it, we need to fight it out. We are fighting out. Stay distant, stay separate, stay kind of not showing not touching, staying different, keep close to the family, but be away from corona is the slogan. And regarding positive mental health, I would say let us all pray, practice yoga, practice pranayama, do a relaxation, home, om mantra or whatever meditation you practice,
Enchanting home.
chanting om. All these things actually, and of course, changing your lifestyle a little bit to during the lockdown period and helping each other so that finally the corona has to run away and we develop immunity to corona. I think that's very important. Thank you.
Perfect. So one more question to you, sir. As like we see in US and in other countries, there are I think more than 50 million cases of depression as per the study. They have small communities, they have small groups, they have societies where people act as buddies, where they were into depression, they have come out and they have made a group of people, right? They can come at any time, like if it's in the night, like 2 o'clock, 3 o'clock, you can just come and type, I'm not feeling well. Hey, I'm not feeling well. I'm
Yes.
not okay. So those kind of people help. What is the action that the forum, as per the government, is helping to create in India, and why not it has been introduced up till now?
See, self-help groups are there across the country as well. The forum, for example, which you suggested by Deepika Padukone, Live, Love and Laugh is a self-help group as well, if you may. Self-help groups are there in Hyderabad also. For example, we have the multiple centers which are they join together on a particular day and talk together. No, we need to promote them.
Yes,
We need
we are
to
not
take
promoting them. None of us know.
No, but we need to form and promote them. For example, for suicide, there are a lot of self-help groups in this our own city and across the country as well. Befrienders International teams has been like that. Alcohol Anonymous is another group which helps in people with alcohol. Likewise, depression groups are also there across. You're right. Self-help buddies groups are
Yes.
especially in software industry are all forming. But I think a lot more
The
can be done. There is
promotions are not happening properly.
no, I think you're right. Promotions won't happen de novo within themselves. We need to work with the system, and I think activists like you across the country need to form small groups. We
Thank
start
you so
always,
much.
and then
I have already formed a group, sir, where I run my channel on What's Your Story. That's why you are here. So it's an extension of my group, which is called
exactly.
What's Your Story, where I want people to write. I encourage people to write their stories, who might
Yeah,
know that
blogs,
I
stories,
have,
communication. We
yeah.
can do that.
Yeah.
Good.
So one very last question to you, sir. Kids are not going to school. The education system has changed drastically. What
Yes.
what do you have to speak on that?
I think it's the most important time. Again, as I said, Corona is once in a lifetime for each one of us.
Yeah.
The education pattern is to change. Now, parents, I would say few small tips. One, this is a time where you are now changed partially to in vitro classes, and rest of the time, parents or parent figures have to spend time in creative arts, music. Let the child expose. Don't give a mobile to them to play because you are busy. Never do that. Now, even if you're giving a video game, better be with the child. And we play creative games like word spelling or like
I do that.
systematize the day-to-day routine. Give the positive strength. And if a child is interested in, because you can't go too much into the public place, maybe indoor games, chess, and other games have to be promoted till the
Yeah,
lockdown is over. So a
yeah,
lot of things depends
yeah.
on, you can say de novo changes in the system, and we can do that.
Yes, sir. Generally, it's believed that COVID has come for a good purpose where we are together. But it's uh, again, we need to work harder to,
Yes,
have a self-confidence levels in ourselves to
exactly.
prove the strength in us. So,
Yes.
give us why the society is shy? Why can't it open up? Give a message on that, sir, before leaving. I know you
I
have less time.
I know the simple message is, see, we have to join together to help our distressed burden emotionally at times. The simple message is depression is just like any disease which can be treated, or the psychological. I always talk about positive mental health. It's
Correct.
now the World Health Organization, in the definition of the health, actually includes mental health and spiritual health also. So we promote both the positive mental health and spiritual health to make them much more positive.
So
So
you,
my message is very simple. Let us all build, try to remove the negativity within ourselves, try to promote the positivity of each one of us, and then bring a larger emotional, positive world. We do pass through bad periods, but we are going to be successful in the end, always.
yes, and I believe that everything in this universe happens for our own good. If
Good.
we believe in this, I think we
Yes.
all can know what has happened to us and what we are and what we will be, how we can shape.
Thank you. Exactly.
And I think we should do more of pranayam, yoga, meditation, and also include walking. If not too much of gym is available for everybody at home,
Yes.
and little bit of your own self exercises can help, help you cope up with all the situations. I think.
Yes. Yes.
So thank you
Thank you.
so much, sir, for coming on the
Good,
board and
madam.
speaking such valuable things. And I hope my viewers have gained some knowledge about it and do implement what sir is telling, and all of us together, we can do it, we can eradicate,
We can
we
do
can
it.
fight for it. Thank you so
Thank
much,
you.
sir. Thank you
Thank
so
you.
much for joining. Thank you.
Thank you. Good.
Thank you, sir. So thank you everybody for joining me today in this live session with Dr. G Prasad Rao. And my only message to you is through this interaction that please be positive, have positive aura. You all can do it. I can do it. We all can make this world a better world. Problems keep coming and going. We have to face it with a stronger mind and not with just submitting ourselves to something that, no, this is not done. I can't do it. I'm fit for nothing. Please take these words out from your mouth or from your brain. You know, you can do it. Always believe in yourself. And for this reason, as What's Your Story by Madhavi, I have created an extension group on Facebook with M Narula ID. Do go join the group, write your stories so that I am a stranger to everybody. I want to know your stories. Who knows? One will be here with me live. So I'm waiting for your stories. It needs not to be a creative writing. It should come from your dil se. And I, first of all, really want to thank sir for spending so much of time, his valuable time, and so much of information. And the previous show, which was with very ad queen and a model, Miss Jyoti, could not happen because of the very demise of Shashank Singh Rajput ji. So we'll be resuming that very soon, and the intimation will be given to you. So keep loving me and keep supporting me. Thank you so much. I didn't